You were a lone voice of reason during the pandemic that, for me, you were extremely valuable. And I was cheering you on every step of the way. When you were grilling Anthony Fauci, with all due respect, you do not know what you are talking about. That guy was driving me fucking crazy. It was mind-numbing how many people were going along with it and how many people just accepted what he was saying, ignored all the evidence that pointed to gain-of-function research, didn't freak out when it was quite obvious that he was lying about gain-of-function research. And I just thank God that you were grilling him, and at least it was on the record, and we could all watch it and see it.
One of the greatest tragedies, and we knew this within days, was that children weren't getting sick, but that should have been used to our advantage. Children did not get sick. No child without a health issue really died.
Well, they
Zero.
got sick, but it wasn't dangerous for
Right.
them.
But
My
they
kids both got it.
Right, but most of them had a very mild illness. And the point is that we knew this in China in the first couple of weeks, and we could have left the schools open. And some countries left the schools open. For the most part, Sweden left their schools open and treated this completely different and turned out with a similar – everybody wound up with a similar death rate, with primarily the people dying were people were older and overweight, or both.
Right. And well, the argument was you're going to bring it home and you're going to infect your grandma and she's going to die.
All right.
That was
The argument didn't really hold water, though, because everybody got it anyway. And so,
but we didn't know that in the beginning, right? In the beginning, they were lying, and they were saying that, although we now know that there was no data that showed that the vaccine stopped infection and stopped transmission.
But here's another thought. You could have said, yeah, kids could take it to their grandparents, so until the kid has gotten it and recovered for 2 weeks, tell them not to visit their grandparents. You know what I mean?
Well, the problem was the people that live with their grandparents.
Yeah, I know. And there would be the exceptions to the rule. But most of the people, the death rate we already knew in China was very, very small once you added in the kids. Initially, they were saying it was a 3% death rate, which would have been, instead of 1 million people, would have been significantly more. 3 million people may have died. But they knew the death rate was less than that in China early on. But part of the reason they thought it was so high is they weren't counting all the asymptomatic cases. They knew how many people were sick and how many people died, but the denominator was the number of people who actually were sick or who actually got the infection, but they weren't counting millions of people. And but Anthony Fauci denied this at every step. He denied that natural immunity would protect you. And one of my favorite quotes was from a guy named Martin Kulldorff. He was an epidemiologist at Harvard who ended up getting fired. But recently he tweeted out, as about a year or two ago, he said, well, we knew about natural immunity from the time of the Athenian plague in 436 BC, and we knew that knowledge until 2020. Then we lost all knowledge of natural immunity. But the good news is in 2025, we're starting to get back that knowledge. But this was, Anthony Fauci knew better. He couldn't even read his own basic immunology books about, the fact that you do develop immunity. Is it perfect? No. Can you get COVID more than once? Yes. But I defy you to tell me somebody who got it the second time who died the second time. You know what I mean? People got it less severely so the second time they got it, if they got it at all.
Much less severely so. I got it twice, and the second time I couldn't even believe it was actually COVID. It was back when we were testing every day. We would test all the guests. We would test all the staff before we did the show. And I came in and I had the sniffles. That's it. And they said, you have COVID. And I was like, this is hilarious.
And I understand you did so well because your personal doctor was Sanjay Gupta. That clip of you and he on the program is my favorite clip of all time.
I don't know what he thought was going to happen. I think he just thought he was going to come in here and CNN was going to send their medical mercenary in with all his knowledge.
Right.
But you can't argue with someone when you can't use facts.
Right.
So he didn't have any facts at his disposal. And he was working for a network that was openly lying about me taking veterinary medicine. Like, the whole thing was surreal. And for someone who is, up until 2020, I mean, I was reasonably distrustful of mainstream news, but in a normal way. Like, I'm sure they bend things a little bit or twist things a little bit. I would have never thought I would watch a campaign against me like that, where every night it was horse dewormer, Joe Rogan, dangerous conspiracy theories, COVID denier, vaccine denier. I was like, this is fascinating.
I think it brings up a broader question, too, that when people tell you there's a consensus, and because the consensus exists, you cannot object. I think that's a real danger to openness, to new ideas, but it's also a danger in medicine. And in medicine to say this is the consensus and we're not going to do this. So in the first month of this, maybe first or second month, Fauci comes in and I said, many people who die from the flesh-eating bacteria, which is not the same, but it's a serious illness, what they give them to try to treat them to prevent death and loss of limbs is high-dose IV steroids. And I had a friend whose life was saved. He didn't lose any of his limbs, and he had this terrible illness. And so I asked Anthony Fauci, I said, do you think there's a chance, as they're getting very, very sick and their lungs are filling up with fluid, that we could try high-dose IV steroids like we do in other infections? And he said, oh, no, we've tried that. Turns out, and we mentioned this in the book, the best treatment when you are just about to go on the ventilator or on the ventilator when you have a 50% chance of dying at that point was IV steroids, an old generic medicine that Big Pharma doesn't make much money off of.
Which steroids in particular were they using?
It's called Solumedrol, but it's just IV steroids. And it was a 36% reduction in death, which is pretty significant when you're in the ICU. The people in the ICU were very, very sick. It was a third of them had a reduction in death by taking IV steroids, but he was dismissing it from the very beginning and already acting like, oh, I know it's not going to work, and we're going to try remdesivir, which turned out not to work very well.
Not only that, it gives people kidney failure. Well, I mean, he has a history of using medicine that has already been through the approval rating with, what they did with AZT during the pandemic of AIDS.
Right.
And that proved to be horrific, a terrible disaster. It's just amazing that the same guy ran the same playbook,
Yeah, no, and it was really sad. And the other thing about natural immunity that needed to be brought up is, so all the people that were declared essential kept working. Like if you worked in a meat processing factory, these are hardworking people. Many of them, they're busting their butt all day long. And there'd be like 296 people at a meat packing place in Missouri. All of them got COVID. Most of them survived, but what we should have been telling them is 2 weeks after you got it, come back to work. You don't have to wear a mask now. You've had it. You have immunity. You won't spread it to your family. And guess what? All the unknown about whether you're going to die or not, you survived and you're done. But instead, we told people you might get it again and you still might die and you got to wear a mask all day long, when in reality, we should have been celebrating the people who recovered and letting them have their freedom back.
Well, there was also this kooky thing where after you got over the disease, they wanted you to get vaccinated, which was strange. It was almost like they wanted you to join the team, like take the blood oath.
Yeah. I met a man in Orange County, and his mom was like 83, and she was very sick, and she ultimately died from COVID probably. But she went to the hospital with COVID. They wouldn't admit her until she was vaccinated for COVID while she had COVID, which is actually against all recommendations. And this is the problem with the mass vaccination thing. If you're going to Walgreens, do you think they ask you if you've had COVID recently before they gave you a shot? And so really the best medical recommendation for a young person is, one, you don't need the COVID vaccine, but you certainly shouldn't be taking it close to when you've had an infection, because you've got an immune response that's going against the disease. Then you add in another stimulant to it that's actually related to an increase in the rate of the heart inflammation that comes along with vaccinating some of the young people.
Well, there's also the weirdness of what happened during the Reagan administration with vaccines, where they're no longer liable for any vaccine injuries. And when you call this a vaccine, it's very different than any vaccine that had ever been used before, but yet you have all of these injuries that people have no recourse.
Yeah, my dad was in Congress at the time and voted against, giving them the liability protection. And he also was there when they had the swine flu epidemic. And in that, more people died from the swine flu vaccine. And I think there were no deaths from swine flu. They said, oh, it's going to take over the world and, we're going to lose, 5% of our public. Nobody died. The epidemic quickly stopped, but then several people got Guillain-Barré and a few people died from the vaccine. And I'm not against vaccines. Look, there are many miracles to vaccines, but they should be used judiciously and the risks and benefit for each individual. And it turns out COVID had an age differential that was more significant probably than any disease we've ever seen. It really was an old person's disease.
Yeah. An old person and people with comorbidities.
Exactly.
It was really bad for obese people, But the disease aside, what was it like for you to watch this play being run? Because that's essentially what it was. It was like there was a play being run, and you had to follow whatever their narrative was to the T, or you'd be attacked. And you would see these people that were acting like soldiers for the pharmaceutical drug complex. I mean, they would go out there and just brutally attack anybody who deviated from the narrative, say the most awful things, talk about how there was blood on your hands, and it was very strange.
Well, the belief in the vaccines and the belief that you should do it was like a religious belief, and that's the way they treated it. So if you didn't believe in it, you were someone to be demonized as a non-believer. You were to be cast out, and you weren't patriotic if you weren't wearing a mask. And even after I've already had it, I'm walking down the hallway, between the office buildings and the Capitol, and all those reporters, they're 22 years old. Most of them are journalist majors. They never had a science course in their life, and they're lecturing me about why I should be wearing a mask. And it's like, I already had the disease. I've healed up 3 weeks. I don't need to wear a mask. I've got immunity. Well, how do you know that? But even in the beginning, when they said they didn't know, they did know. We had a outbreak in 2003. It was a different coronavirus. It was the first SARS virus, but we knew that those people 17 years later still had T cells and still had immunity to it. One of my favorite stories, and we include this in the book, was there was a woman, and she was 102. She goes to the hospital, and they bring her family in. They're talking to her daughter, who's 85, says, "We don't think your mom's going to make it." And she said, "Have you met my mom?" And they said, "Well," and she survived. But while she was there, they decided to test her for antibodies to the Spanish flu, because when she was 6 months old, her mother was coming across the Atlantic. Her mom died from the Spanish flu. She got it, survived. They tested her 100 years later. She still had antibodies to the Spanish flu. So immunity lasts a long damn time.
Wow. That's crazy. But what was it like being in the government and seeing all this play out, and that it was illogical, it didn't make any sense, but yet everyone was following the playbook?
Well, people without any kind of scientific background were lecturing people. Sherrod Brown from Ohio was a senator. He was the worst. He would stop the proceedings and start pointing and yelling at me for not having a mask. In the House, they made him wear the mask, and so you got everybody in there with a mask. I got the infection like in March of 2020, so I got it just as it came over. I'm all healed up. I volunteered in the hospital when I was done because I had immunity. And at that time, you're right, we didn't know everything, and there were some risks to the orderlies and nurses. So when they had to rotate patients that were on the ventilator, I would go in and help them. So one less person had to go in the room because I had immunity. And everybody acknowledged that I did in my local hospital. They didn't ask, there was no vaccine at the time anyway. And so, but they all acknowledged that, oh, this is great, he's coming in, he has immunity, and he can help take the place of someone else who's having to risk being in the room when we move patients around.
One of my favorite scenes was there was a musical performance where there was a bunch of flutists, and they had masks on with a hole cut out so they could play their flute through the mask. I was like, This is wild.